The world of hip-hop and entertainment has been rocked by one of the most shocking revelations of the decade. Diddy Combs, the legendary music mogul, is reportedly battling a serious health condition behind bars. According to an alleged insider from the medical wing of the prison where Diddy is being held, a doctor has confirmed that the Bad Boy Records founder has contracted HIV while in prison. This revelation, if true, is sending shockwaves across the industry, sparking discussions about Diddy's secret lifestyle, the dangers of incarceration, and the impact of such a diagnosis on his future. But how did this happen? What does this mean for Diddy's empire? And could this mark the downfall of one of hip-hop's most powerful figures? Let's dive deep into the allegations, the medical implications, and the reactions from the public and those close to the mogul. The claims first surfaced through an anonymous source, supposedly working within the prison's medical unit. According to this individual, Diddy had been experiencing unexplained weight loss, severe fatigue, and other symptoms consistent with HIV infection. It wasn't until a routine medical examination that doctors allegedly decided to run further tests, leading to the shocking diagnosis. Medical professionals within the prison were reportedly stunned by the results, given the gravity of the situation and the high-profile nature of their patient. The unnamed doctor, bound by patient confidentiality, allegedly leaked the information to a trusted contact, who then spread the news through underground media circles. If this information is accurate, it raises major questions. How did Diddy contract HIV in prison? Has he known about this diagnosis for a while? And how will this impact his ongoing legal battles and career? There are several theories circulating regarding how Diddy might have contracted the virus. One of the most prevalent theories is that he has been engaging in risky behaviors behind bars, something that has been speculated about for years, even before his incarceration. One possibility being discussed is that Diddy may have been victimized while in prison. Reports have long suggested that high-profile inmates can become targets, especially in environments where power dynamics and violence play a significant role. Consensual encounters with other inmates. Another theory is that Diddy has voluntarily engaged in relationships while incarcerated. There have been long-standing rumors regarding his private life, and some speculate that his alleged history of secretive relationships could have continued behind bars. Pre-existing condition. Some believe that Diddy may have already been HIV positive before entering prison and that the condition only worsened due to stress, lack of proper medical care, and deteriorating health conditions in prison. Contaminated needles or medical negligence. Another plausible scenario is that Diddy may have contracted the virus through unsanitary medical practices or intravenous drug use, though there has been no evidence to confirm such speculation. Regardless of the method of transmission, the implications of this diagnosis are massive, both for Diddy personally and for his empire. Diddy, once one of the most untouchable figures in the entertainment world, has been facing a steep decline, with multiple lawsuits, criminal investigations, and now a rumored serious health condition. The empire he built over decades seems to be crumbling. With his legal troubles mounting, brands and business partners have been distancing themselves from Diddy. If the HIV diagnosis is confirmed, it could further alienate investors, collaborators, and associates. While the hip-hop world has been known to rally behind fallen stars, an HIV diagnosis in a hyper-masculine culture might bring additional scrutiny and controversy. The stigma surrounding HIV, especially in the hip-hop industry, could lead to further ostracization. Diddy is already fighting multiple lawsuits, and this revelation could play a role in those cases. Plaintiffs might use the diagnosis to push claims of reckless behavior, particularly if any accusations involve unprotected encounters. Diddy has always been a family man in the public eye, but this situation could create tension among his loved ones. How will his children, former partners, and close associates respond to this news? Some reports suggest that those closest to him have been aware of his deteriorating health for months. As expected, social media has been buzzing with reactions to the alleged news. Some fans are in disbelief, refusing to accept that such a powerful figure could be dealing with such a devastating health issue. Others see this as karma catching up to the mogul, citing his controversial past and numerous allegations of misconduct. Known for his relentless trolling of Diddy, 50 Cent wasted no time in posting cryptic messages hinting at the news. While he didn't directly confirm anything, his posts have added fuel to the speculation. Some artists have shown sympathy, acknowledging that regardless of Diddy's past, no one deserves to suffer from a life-threatening illness. Others, however, remain silent, likely waiting for official confirmation before making statements. If the allegations are true, Diddy's diagnosis could spark conversations about HIV awareness, stigma, and the need for better healthcare access, especially within the Black community and hip-hop culture. Beyond the speculation about Diddy, this situation highlights a serious issue: the prevalence of HIV in prisons. According to reports, inmates are at a significantly higher risk of contracting HIV due to limited access to condoms. Drug use and sexual violence contribute to the spread of the virus in prisons. Medical neglect. Many prisons lack proper healthcare facilities, leading to delayed diagnosis and inadequate treatment. Due to fear of being ostracized or targeted, many inmates avoid getting tested or disclosing their status. If Diddy has indeed contracted HIV while in prison, it serves as yet another example of the need for major reform in the prison healthcare system. If the rumors are confirmed, Diddy will have to make a public statement at some point. His next steps could include, if he truly has HIV, getting access to the right medical care will be crucial for managing the disease. Legal defense strategy. His legal team may use his health condition as a reason for leniency in ongoing cases. Public relations spin. Diddy could choose to rebrand himself as an advocate for HIV awareness, using his platform to educate others. Regardless of what happens next, one thing is clear: Diddy's legacy is now permanently altered. The music mogul who once dominated the industry with Bad Boy Records, built an empire of wealth, and shaped hip-hop culture is now facing his most difficult chapter yet. The rumor that a prison doctor has confirmed Diddy's HIV diagnosis is a bombshell that, if true, will change everything. Whether one sees this as tragic, ironic, or simply another twist in his controversial life story, it's a moment that will be discussed for years to come. Only time will tell how this situation unfolds, but one thing remains certain: the world is watching, and the hip-hop industry will never be the same again.